Welcome to the podcast. I have Eileen Drew here. I'm going to ask a few questions. I'm going to have Eileen introduce herself within the first question, which is, what led you from a nursing career to dedicating your life to the ministry for Jesus Christ?
I'm a retired RN, been retired for about 8 years now after a 46-year nursing career that involved various kinds of nursing, from office nursing to ICU. So it was quite a span there, different specialties. But ICU was always my favorite. I always, from the time I was a child, wanted to be a nurse. And I never deviated from that except to consider maybe teaching high school English. But it was always wanting to go back to nursing. And I think that looking back, I think it was because I was probably, I believe we're all given gifts when we're created by a creator. And I believe I was given the mercy gift and compassion. And so I was drawn, that was in me, and I was drawn to that kind of profession, caring profession. And back in those days, which was quite a while ago, it was a really altruistic profession. And I watched it over the years that I practiced nursing really evolve. But even as a child, I remember hearing about divine healing when I was 8 years old. And it was the first time I heard about God. And I thought he was awesome. And then I heard about divine healing, and I used to watch programs on TV, and I really believed it. I believed in divine healing. So since I was 8 years old, I believed in divine healing. I fast forward to getting out of high school and then moving. I was in Pennsylvania, and then I moved to Vermont and started nursing school in Burlington, Vermont. After graduation, I started my nursing career right in the ICU. And that was just short-lived because I ended up taking maternity leave. I got married the same year I graduated. And while I was on maternity leave, I decided I didn't want to go back into ICU. It was too stressful with a new baby. So I went to ENT nursing and ENT and orthopedics just for a short time until my pediatrician hired me for the office. And so I did some office nursing for a few years and then transferred to Kansas, worked in a big clinic in Wichita. And then that was only a couple of years, but came back to Vermont because we missed Vermont. And I went back to the office. I did office nursing in the allergy office, but I found it so boring. And I just decided really missed the hospital setting, the clinical picture and everything. So I took a refresher course because I'd been out of the hospital for a while, and went to work in a small local hospital, Fanny Allen Hospital. It was a little Catholic hospital, and they put me right in ICU. And so I spent several years there, um, doing a variety of nursing. I did ICU recovery, I did some transports, I did float nursing, and recovery room, and I did a little bit of oncology. So I really got a bit of experience there. But 6 years into my nursing career, I had a spiritual experience, and that led me to believe in Jesus Christ and into a personal relationship with him. And life took on a whole new meaning, and that even spilled into my nursing career because then I began to see nursing as a ministry and caring for every patient that was assigned to me with compassion and care and the love of Christ for each one. So that really, and I found it so fulfilling. So my nursing career evolved to a current healing ministry that I have now, but it started with I saw patients being discharged way too soon from the hospital, and all their needs weren't being met in the community when they went home. So I decided to look into a new specialty in nursing called Parish nursing, and I started taking courses out of Concordia University in Wisconsin to learn more about it. And at the same time I was doing that, the nuns who are running the hospital I was working in had heard about it too, and they were exploring that possibility. So we worked together, and long story short, there was a nun who came from Montreal and was interested in that kind of nursing. And I shared my vision with her, and we partnered up and we went to all the local um, churches and introduced parish nursing in the community. And that was in the Burlington area of Vermont. And
Was
practiced
parish
that for,
nursing something that was currently being, like, offered at that time?
it was still very new.
Yeah,
It was very new. And now, I mean, after several years, now they offer it in the curriculums at many of the universities.
yeah.
I think St. Joseph's in Maine was one of the first places. Anyway, we introduced it to all the area churches, and then you can operate parish nursing out of a hospital or out of a church. And so I did kind of a combination of both, and I had to have a board, and I got together some doctors and nurses, various people from various walks of life to put together the board. And the priest of the Catholic Church in the community I lived in was on my board, and also my pastor from my church. So I started the program and called it Wellsprings Ministry to offer to people who were pushed out of the hospital too soon services like not things that the VNA would do, hands-on nursing care, but to offer respite time for people, rides for people, and that sort of thing. And I trained volunteers from both the Catholic Church and my church. We would meet 1 month at the Catholic Rectory, and then we'd meet the next month in an office that I was given at my church, and training the volunteers for how to take care of people, meet their needs, mostly providing spiritual support because they needed that as well as respite care and rides to dialysis or whatever, or just companionship. And so that I practiced that for a few years and then moved further north in Vermont and kind of left that behind. Moving further north to Vermont, I ended up in another small ICU, and that's where I met you, Chris. I was working there in Newport, Vermont.
So I
And
figured out, I just did a little math, we have known each other for 20 years.
wow.
Mhm. 'Cause it was 2000 and when did I take that job? It was either 2002 or 2003.
Okay. Well, I went there in 2001. Yeah.
Shortly after you, I came on, and
Yeah.
we worked together in the ICU.
Right. Yeah. So, I really always enjoyed the small ICUs, small hospital ICUs, because it was more personal, and I loved having more like a 2-to-1 nurse patient ratio or 1-to-1, whatever, because I really enjoyed the bedside place. I did not want to get into any kind of management because I really wanted to do the bedside nursing and see that seemed more fulfilling as a ministry. And I wasn't there very long when I was asked to fill in for a local pastor who would start going to Florida in the winters to do chaplain coverage, volunteer to be a volunteer chaplain. So I said I would. I mean, I didn't ask for that. They came to me, and I think they knew, about my faith. And I agreed to do that for the winters, and it turned out to be like
Full-time job?
12, it turned out to be 12 years of volunteer chaplaincy alongside of my nursing. Some days I wore
Full-time
both
working as
caps.
a nurse, that's a
hmm
lot.
Yeah, well, there were a handful of times that I wore both hats, being called into emergency situations. And anyway, that really coupled well with the nursing because parish nursing in the hospitals was, really developed because nurses really got to know the patients and would round with the doctors and so that started and they brought faith into it. I think it was the Lutheran synod in maybe Wisconsin, one of those Midwestern states that started that. So the parish nursing I put behind, and I just practiced the volunteer chaplain and nursing all those years. And it was great pairing those two, what I considered ministries up. and I enjoyed that.
So I think you already answered, can you share a moment from your nursing career that deepened your faith or pointed you towards the life of ministry?
Oh, I know, when I was working in the big hospital before I moved further north, I really, even in the small Catholic hospital, I really bonded with the pastoral care staff. And and then when I went to the bigger hospital, I did a project because the Joint Commission for Accreditation of Hospitals was marking marking hospitals on if they provided spiritual care for their patients because that was part of their plan. And I recognized that nurses were having a hard time assessing their patients for their spiritual needs. So I did a project. I did a little teaching with nurses and working with pastoral care staff, and implemented some questions into the admission database that would help to meet those patient needs. So that's backing up a little bit, but
How about a time? Can you describe a time when your faith helped you support a patient or a colleague during your nursing career?
yes, this was a time when, I mean, most of the staff knew that I was a volunteer chaplain, and when I agreed to do that, I didn't really realize that I would be providing support for colleagues too. It was mostly being called in, like for a sudden death or whatever to the ER. But I got called in one morning early by the director of nursing at that particular time. A mother who had delivered, she was 1 day postpartum. The morning after she had her baby, she sat up early in the morning on the edge of her bed and said she couldn't breathe. And she did have some underlying comorbidities before she was pregnant, some respiratory issues. Anyway, long story short, she coded and passed away. And so then the director of nursing called me in. And when I arrived at the hospital, the priest was arriving at the same time. And we both reported to the maternal child health care unit. And she assigned the priest to go administer to the family. And she said, "You go take care of the staff." So I found a room, a quiet room. There was an empty room in the ICU where I could pull the curtains, and I got some maintenance people to bring extra chairs in, and we made a big circle in that room, pull the curtains and shut the door so we could just sit and debrief, to talk, let people talk and offer prayer, because everyone was devastated. The doctors, the nurses, everyone they were all just devastated. So um, that was an instance that um, I was
Yeah,
able to
that's
minister to the
beautiful.
colleagues.
I think we forget that as healthcare workers that we grieve too. We go through the grief process with our patients. We may be a little more stoic about it, but it's certainly it goes through our bodies and our
Hmm.
minds
Definitely.
and our
So
spirit.
that helped, momentarily for that day, and then people were plugged into the employee assistance program to get further grief counseling if they needed it. They needed to be a chance to come together and debrief and get their grief out and express their hurt and devastation at the time. And so that was good. I could offer prayer if anybody wanted to.
So do you think how would you describe like the healthcare system today?
Yeah.
It's certainly moved further away from spiritual nursing care. And
Hmm.
what role does faith play in addressing its challenges? Because I've worked in hospitals where there is not a chaplain. It's the nurse or,
Yeah.
and
Um,
there are, and I will say this, and in phases of my career where faith wasn't priority, and there are nurses that have told me that they're atheist.
yeah.
So how does that factor into healthcare and caring for a patient in those types of situations?
Well, just because they don't have a pastoral care department or a chapel, for instance, doesn't mean that there aren't spiritual needs that need to be addressed. And I don't know if, with the bigger hospitals, if JCO still marks them, and they're accrediting hospitals in that area. I would think they're being assessed for that, but I don't know. I mean, I've been away from that setting for a while, and I don't know if the Joint Commission is still considering
Looking at
that.
that.
Yeah,
Yeah.
I don't know. I think it's unfortunate that if they don't have a chaplain or any kind of pastoral care department in a hospital, it's going to be a hit or miss thing depending on who you get for a nurse and where she's at. And so that's really a sad commentary. I just yesterday, the little hospital I was working in here that I retired from didn't really have a chapel, but they had a like a consultation room where I set up some pamphlets for people to read and look at, and we would help people with, like sudden death and help them make phone calls and help them through the steps. What do we do now? We had scriptures available for them to read. Sort of we made a little bit of a chapel out of that room. During COVID, of course, families were separated. They couldn't visit their loved ones. Even even pastors couldn't visit their parishioners if they were in the hospital. So at a time when there was the greatest need for that kind of support, it was really lacking. But the hospital I was in then, well, I was retired then, but they had hired a part-time chaplain, but she only worked 20 hours a week, and she did 24/7 coverage. I asked her, and she said, yes, I'll do that all. But you know, after COVID, she left and went to the VNA or in hospice. And to my knowledge, there was a great volunteer chaplain program there, and that ended.
Oh,
And
right.
so, and
Yeah,
then I went into the hospital, and now they don't even have a chapel. It's the only hospital I've ever been that didn't even have a chapel. And so even yesterday when I was in another hospital that had a really wonderful little chapel, I sat and emailed patient relations director at that little hospital that I retired from. And I said, this is really sad. I gave some history and I said, so how are you meeting the spiritual needs of patients in that community now? And she did say, well, we have a resource list of people to call, but she said, if you know somebody who would like to be on that list, let me know. And I said, well, I would. I mean, there were several of us that were on. I don't know if they're calling people anymore. So it's
yeah,
sad.
because I've worked at a hospital where there wasn't a chaplain, and it was sort of nurse's responsibility and social work, even though
Yeah.
they
Well,
wasn't their, like, specialty.
no. And it's awkward. I mean, I know when I did that project educating nurses about how to assess for spiritual needs, you know, it was awkward for them because most of them didn't know how to do that, or they weren't believers, or they just didn't think about
It
that part of a person,
it
and
it
that's an
also
important.
when I remember in nursing school, it was not something that was taught, it was
No.
just something on the job that you had to deal with when you
Mhm.
experienced probably a death or near close to death, and even so, years I did not feel prepared to deal with that aspect of nursing.
No, and it's a very integral part of the care of the person. I mean,
In
you
fact,
can't
I would
ignore the
say it is the
spiritual.
most integral part as I'm maturing into my nursing career, the
Well,
most
it is
important
because
part.
I've always believed that if you're spiritually healthy, then it's going to filter down to your emotional health, which filters down to your physical health. It's directly related. You can't ignore that part and expect to do well. I mean, I studied a lot and read about healing and testimonies. I've heard testimonies. I think there are doctors now getting some of this in medical school. Um, there are doctors who pray with their patients. I read testimonies about surgeons who would pray with their patients, and their recovery was so much different because of that.
It's so important.
It is.
Let me ask you this question. What's the most rewarding part of bringing Christ's message, Jesus Christ's message to others, especially those who are suffering?
Well, it's a message of hope, and we have to have hope, and I saw that so much the short time that I practiced oncology nursing. I loved that patient population. They're so courageous, and I learned from them. But people have got to have hope when they're sick, when they're going through that sort of thing, crisis, health crisis, or even near death. Offering the gospel, the message of Jesus is a message of hope and for the future, no matter what happens to you, because of the opportunity to choose eternal life. So, and being volunteer chaplain, you can't you can't really proselytize when you meet with people. But my experience oftentimes was, asking if you ask the right questions, people will open up and start sharing. And, like asking them, well, what does your faith mean to you, or what's important to you spiritually? And I've had people just kind of pour their heart out and then say, well, I don't know, I'm telling you all of this, but it's the presence, it's the presence of Christ in us that draws them, and people will open up, and then they can share, and then you can minister to their grief, or their hurting,
And
their
what would you how would you approach a conversation about faith? We've discussed this with people who may be skeptical, specifically towards
um
Jesus Christ.
I think the best approach is to take is to share your own testimony, because your own experience, no one can dispute that. And I have personal testimonies of healing myself, healing from cancer and healing from trauma, healing from other things that I can share. And that's what drew me. I heard someone else's story, and I thought, well, if God would do that for them, then they would do that for me. And so I think, and then the asking questions too, sharing what knowledge you have, but I think testimony is the most important thing.
I agree. What's one misconception, or actually, what challenges have you faced transitioning from your clinical role to your full-time retired? I wouldn't say that because you're doing ministry work. And how did you overcome that?
Well, it really was not a challenge, because it was really pretty seamless, because I'd been practicing. I mean, it was integrated all those years in my last several years of nursing. I was just excited when I could retire from hospital nursing to be freed up to spend the time addressing people's spiritual needs and giving spiritual care, because it was a little frustrating in the hospital with the changes in healthcare, having to spend so much time documentation, so much time with your nose buried in the computer. I felt like it was pulling us away from that bonding and that relationship, the rapport you establish with a patient, and being able to take the time to sit down and listen to them, which is oftentimes what they needed most. And it was frustrating to be so torn to get your documentation done and run, and if you're short staffed. So there was no challenge for me to transition. I was really loving the fact that I could take all the time I wanted after that.
I mean, sadly, nursing has become a profession of completing
Yeah.
tasks and not.
Mhm. Yeah. And it evolved from all the years that I went into it into big business.
Yeah. I
And
mean,
I
that we could
see,
tackle that in another podcast, the transition of
yeah.
nursing care
Oh
from
yeah, there's a lot there that
mhm,
over the span of all those years.
from when
And
we were
it's
actually a person instead of an FTE and
yeah. Yeah,
trying to, like,
exactly.
fit. I
Right.
often said that if you hired enough nurses to, like, make things flow easier and allow nurses to have full breaks and never, just it was never stressful. And if that meant there were lays in the day because you had too many, that would be better than just constantly running with your head cut off and trying to like get it all done in a 12-hour shift.
Right. I know that I had opportunities throughout my time in nursing wherever I was. I mean, even when I did ambulance transports, I could pray for my patients. And I never had anybody crump on me.
Wow.
And I was never in an accident in an ambulance. Other nurses were.
Wow. And those were long transports, at least from
Yeah,
Newport.
you're out there 2 hours. You're out there 2 hours pretty much on your own. But I would always pray. I'd sit in the back and pray for them, and it was always a good ending. I mean, smooth transport.
And especially too with the ice and the snow and the,
Hmm.
urgency to get to Dartmouth or wherever you were transporting the patient to. Yeah.
Yeah, I remember before I left Burlington, one of the cardiologists said to me, Well, you be careful doing ambulance transports up there.
In
And
Newport.
yeah,
Do I have a question for you? This is a little bit off script, but did they still have the transport team when you left Newport?
they did. And
Okay.
I don't know when you were there. I don't. When I started doing transports, they didn't give us any special training for transport. We had ACLS, but that was it. And you're out there on your own for 2 hours with a couple of EMTs whose scope of practice was pretty limited. They couldn't even check blood sugars back then.
Right.
So after I had done that for several years, they decided that they needed to do some special training for the nurses who are going to do transports. And they ended up having a lot of travel nurses who trained for that. But even the nurses in house who trained for it, I never had that training when I did the transports. But they got that training and they were still doing it when I left, but it was mostly travel nurses who were.
Really?
Yeah.
Because we had like maybe one travel nurse when I
Well,
was.
they don't have an ICU anymore, so they don't
Oh,
have
that's the problem.
they don't have the nurses with that skill level.
Right.
So that's why I think that the transition to the travel nurses doing the transports, they were
Right.
more skilled. Uh,
Because I know when I was there, it was a pretty good deal. You got really good pay to
yes.
come in on your off time, and I fought for that.
Mm.
I was very proud of that because people were wanting to do transports and signing up, and it made my job a lot easier because I was getting called in the middle of the night to go in and do transports, and I was doing them.
Yeah. Well, at one point, they decided they weren't gonna pay as much to an hour to do the transports,
Yeah, I
and at
kinda
that
thought
point, I
'cause
said,
it was like a
yeah.
really good deal. I was just like
Hmm.
when I left, I'm like, "Oh, I hope they don't get rid of that because you
Yeah.
just never know when you're gonna need a train." We were doing a lot of them, a
Yeah.
few a week, if not 1 a day.
Well, I imagine they're doing a lot now because they don't have an ICU anymore.
Right.
And they have a couple of rooms set aside for with a little extra special monitoring equipment. Um,
So,
they
I
don't have
guess a
anybody.
lot of the EMS, programs have, critical care paramedics now.
Well,
So
I know they can do a lot more than
they're
their scope
doing
of
long
practice. Yeah.
transports because in Copley, we would just call them and they would send their team. Okay, couple more questions. What's one misconception about faith or ministry you wish people understood, especially in the context of healthcare? And we've alluded to this.
We did when we talked about, I don't think people realize the impact that faith can have in healing, both in healthcare settings and in homes. Um, I've experienced it through most of my nursing career, and even now, it's such an integral part of healing. And so my healing ministry has evolved, which leads me to, you know, and then I heard about an international healing ministry it's headquartered in Spokane, Washington, and I looked into that and took the training to start open up what's called a healing room in my community. And they can meet anywhere. Somebody in Southern Vermont used the chiropractic office. After office hours, they'd open up the healing room and they had all these rooms to bring people in to pray for them, to pray for the sick. And so in 2011, I opened a healing room in my community, and that has evolved, and has really grown. There are about 1,500 healing rooms all over the world. They're in other nations. And we have 7 in our little state of Vermont. And compared to New York State, I don't think they even have, I don't know if they have 5 in the
Wow.
size of New York, but we have 7 in Vermont and we have a good network. So actually, Saturday, I'm going to Montpelier for a training for ministering to PTSD and trauma.
Wow.
And I did go I went several months ago to one. It was awesome. I had had a rough year myself with 4 surgeries in a span of a couple months. And after one surgery, I just broke out with a rash all over. And I was going crazy because I itched. It was like tormenting and trying to find the cause. several dermatologists. No one could come up with a diagnosis. They did biopsies and all kinds of tests. They knew what it wasn't, but they didn't know what it was. And I went to this trauma conference at the end of March after 9 months of suffering with this, being tormented with this, because it would wake me up in the night and everything. Terribly itchy all over. I got prayer for trauma, and that night I slept through the night and my skin cleared up.
It's amazing.
But even PTSD can be healed. So
So
that's exciting.
it was probably related to the surgery. It was very traumatic for you
I'm
and you
I'm
developed
guessing
the
I'm
rash.
guessing it was because when I was reviewing, thinking about 3 eye surgeries and a gallbladder surgery within the span of a couple months,
Wow.
um, was a lot, and I had a reaction to some of the eye drops in prep for one of the surgeries, and one of the cataract surgeries didn't go well. So I was without vision in one eye for 5 weeks until a doctor who had a special technique could implant the new lens. And while I was waiting for that, I had a gallbladder attack and I had to go in and have that out. And they did it laparoscopically, but they found a gallstone the size of a golf ball. And when I came out of anesthesia, I had a fat lip. Anesthesia bruised my lip. I think there was some trauma involved.
That is very yeah, I think that's what caused you to break out in a rash.
Yeah, I think so. Anyway, it's, healing. I envision being on the verge of a huge healing movement, and we're going to see amazing things healed. I think we're going to see miracles, more and more miracles. And so I'm excited about that because I've been believing for that since I was 8 years old, but it's coming. We're seeing it. And one of the healing rooms is seeing some really miraculous testimonies.
I have goosebumps.
Yeah.
How do you stay spiritually grounded while serving others, especially after all your years of high stress nursing in ICU?
Well, I'm grounded through my prayer life and I've studied scriptures. I I've done 132 hours of scripture study, and I got a master's in sacred studies, fellowship with others, prayer. It's being in corporate worship and prayer and all kinds of meetings, conferences together, experiencing stuff together. There's a lot to be said for fellowship with others. We have a great network with all the directors of the healing rooms in Vermont. We get together and it's just great.
What advice would you give to nurses or healthcare workers who feel called to bring their faith into their work?
I would encourage nurses who feel called to bring their faith into their nursing practice to contact faith based groups, chaplains in their practices, and other nurses who share their desire to add spiritual care, that dimension. And that's what helped me get started in evolving, over the years, like from the Wellspring volunteer Parish nurse model up to the healing rooms. It's just evolved over the years. And all of that was preparing me for what I'm doing now. And it's my second career and I love it.
It's beautiful. Well, I've really appreciated you taking the time to do this for me, Eileen. I really, from knowing you for so long, you have helped me grow in my faith. You were the person that helped me turn it around when I was questioning things and feeling lost and confused about the direction I was going in, especially with the yoga and the new age stuff that I was
Hmm.
starting to dabble in, which I don't anymore.
I
And
think I remember, think, I think you and I talked about journaling
mhm.
and how important I thought that
No, I
was.
was drawn to you. I would always come to you and was trying to pick your brain when I worked with you about faith and your journey towards
Hmm.
that.
Yeah, right, right. Nursing became much more than just a job. It's so much more fulfilling and exciting when you know you can help people in that part of their lives too, and bring hope and faith, and your life is takes on new meaning and purpose, really. We're all we're all created with a destiny, and I think that was my calling from early on. If you wonder what your gifts are, I think nurses really probably got the mercy gift. I mean, a lot of them, it's a job and it's good pay, it's really caring and have compassion and really want to care for the whole person and but offering hope to people and healing spiritually, physically, and emotionally.
To be honest with you, when I decided to become a nurse, I really truly became a nurse because I wanted to help people in their most vulnerable times of
Mhm.
sickness. And then I
Yeah.
was a little bit when I got through was going through nursing school, and when I had really my first job, I was a little bit taken back because I was like, "Is this really what I signed up for?" I just didn't realize how much medication pushing I was gonna be doing and less helping people navigate that
Mhm.
sickness and that,
Yeah.
but I guess, as I'm more mature, I've realized that that is my role to take and
Mhm.
to navigate, and then but yeah. Well, I wanna thank you. The last thing I would like for you to do is, if you could tell me your contact information or social media if people wanna contact you or learn more about your parish nursing or healing rooms,
Mhm.
if you could give me that information, I'll put it in the
If
bottom
you
of
just go into your browser and type in healingrooms.com, it will bring you to um, IAHR, which stands for International Association of Healing Rooms. And that's a global thing. And once you get on that website, you can look and see, you can locate healing rooms wherever. You can go to any
in your
state.
community or state.
Yep, you can check like different towns or whatever and find, and my healing room is listed on there. It tells you who the director is, the name of the healing room. The one that I direct is Healing Rooms of Northern Vermont. And I think we're going to move our location to downtown Newport. It
So
might be on the same street as the urgent care. Wouldn't that be funny?
well, that's where it's needed, for
Right.
sure.
Yeah.
Good.
So, yeah, healingrooms.com, and then you can learn all about it. You can learn how to start a healing room or how to become trained, where they are, where to refer somebody to one. Yeah, it shares the whole mission and everything, and it's just it'll tell you all you need to know. And my contact information, if you look up the Vermont Healing Rooms, my contact info is on there.
Okay. Perfect.
Yeah.
Alright.
The
Well,
vision is to have a healing room in every community
I
because
think
they're all needed.
you're definitely on the fast track to making that happen, you and the entire international team
Mm,
of it's beautiful, and I feel in the last, 5 years, the world has changed,
mm-hmm.
and people are craving
Yes.
prayer and healing and faith in Jesus Christ.
Yeah. And it's I see that beginning to accelerate even more now. Yeah.
Alright, well, I appreciate you.
Thank you, Eileen. This was a great show. I look forward to having you back to dive deeper into spiritual care and nursing.